Hi everyone. So in this video section, I'll be discussing some of the image-based questions which are important for the upcoming foreign medical graduate exam June 2021. And I welcome you all on behalf of DBMCI and eGurukul. And myself, I am Dr. Bharath Kumar V D. I am the pharmacology faculty for eGurukul and DBMCI. So let us start our video discussion. Now, most of the questions in FMG exams are some of the images are coming in between and what are important in pharmacology which you have to concentrate for the exam. So that thing I'll be dealing in this video. Now let us move on to the first question. Now let me read out the question. The adverse effect shown in image is caused by. Now what is this adverse effect? You can see that there are whitish patches on the tongue. You can see the whited patches, and for easy making it easy, I have given the diagnosis also. It's a case of oral candidiasis. Now, where the fungal infection occurs, now we know that in COVID-19 we are seeing all the opportunistic fungal infections. We have seen the black fungus, white fungus, whatever the common people call it as. Now, this is the candidiasis. It is called the oral candidiasis. So, which drug can cause this oral candidiasis? Option A, fluconazole, inhaled budesonide, oral tofacitinib, topical clotrimazole. Now, what is oral fluconazole? Oral fluconazole is an antifungal. It is used in the treatment of oral candidiasis. So we can also use this in the treatment of oral candidiasis. So it will not cause oral candidiasis. Yes, it will not cause. Now what about inhaled budesonide? Inhaled budesonide is a steroid. So it's a steroid which is prescribed for COVID-19 800 microgram BD dosage. Now, when the patient is inhaling through the mouth, and if that gets deposited in the oropharynx, what happens on the long term? The immune suppression occurs. The candidiasis can occur in the oropharynx. Now, that is the culprit. That is option B. That is going to cause oral candidiasis. Now, the question asked is, how do you prevent this? How do you prevent this oral candidiasis when a patient is taking oral steroid, not the oral steroid, the inhaled steroid? How do you prevent it? One is by gargling the mouth. So simple gargling of the mouth will prevent this opportunistic infection. After they take that inhaler, after that they have to gargle for 1 minute. So like that, if they are gargling, the steroid deposition will not occur. Now, if there is a oral candidiasis, what is the treatment? The treatment is, one is the systemic. You can use oral fluconazole, and you can also use topical. The topical preparations what are available is the clotrimazole. The clotrimazole is available, as well as you can also use a topical preparation that is called nystatin. So one is you can use a tablet, fluconazole, and you also can use a topical preparation that is clotrimazole and nystatin. So we have another option, topical clotrimazole. It is used for treatment. It doesn't cause candidiasis. Now what about oral tofacitinib? Now oral tofacitinib is an inhibitor of JAK1 and 3, and it is approved for treatment of rheumatoid arthritis. So it is mainly used in rheumatoid arthritis. So what is the adverse effect? It is oral candidiasis. What drug causes this? It is the inhaled steroids. How do you prevent it? Gargle. How do you treat it? With systemic steroid and topical steroid. So the answer for this question is B, inhaled budesonide. Let me move on to the next question, guys. Use of the following drug in migraine may lead to the adverse effect shown in the image. Now you see the foot, and you can see that the blackish discoloration of the big toe, the second toe, and third toe, and you can see the progression. Now this is what we call as gangrene. So this is what we call it as gangrene, and one of the reason is vasospasm. When there is vasoconstriction or spasm, that will lead to gangrene. So the question is asking you which of the following drug in the option is going to cause this gangrene, which is also used for migraine. Now metoclopramide, yes, metoclopramide is also used in migraine attack. It's an antiemetic. It acts by D2 blockade, and you know that when you block D2, it can produce extrapyramidal symptoms like acute dystonia. Suddenly the neck may turn like this, so it may produce acute dystonia. It is called extrapyramidal symptom. So that is not shown here. Indomethacin is a NSAID, non-steroidal anti-inflammatory drug, and it will not cause gangrene. One of the main problem with this NSAID indomethacin is it can cause headache. Severe frontal headache is one of the problem. Now, can we use indomethacin headache? Yes, you can use it in headache, but certain people can get severe frontal headache. That doesn't mean that it cannot be used in headache. So please keep that in mind. Now, erenumab is a calcitonin gene-related peptide antagonist. So it is a monoclonal antibody which opposes CGRP, and it is not for acute attack of migraine. It is for prophylaxis. So once monthly injection of erenumab is given to prevent migraine. Now what about ergotamine? So you know that ergots, they can produce vasoconstriction, and that is responsible for gangrene. So this is one of the drug used for migraine, and they can cause vasoconstriction, and because of that they constrict the extracranial blood vessels, the headache decreases. But if that is given at high dose, they can constrict the blood vessels in the periphery and the patient will have gangrene. Now one more group of drug used in acute migraine is a drug by the name sumatriptan. So triptans or simatriptan, and if you use ergots with that, for example ergots, if you both use it, there will be severe vasoconstriction and the gangrene will develop. So at least you should give a gap of 24 hours when you're using both sumatriptan and ergots, right? So this is what you have to remember. The ergots will cause vasoconstriction. Even the triptans can cause this. So answer for this question is the ergotamine is responsible for this. Now moving on to the third image-based question, you can see that there are two lower limbs, and if you see that both are swollen, and if you see that this leg looks like a leg of an elephant, and this disease is called as Elephantiasis. It is called as Elephantiasis, and we also call it as filariasis. Now, what is the question? Let us come to the question. Which of the following is used as drug of choice for the disease shown in the image? So, what is the disease you have to diagnose? It is elephantiasis. What is the drug of choice? The drug of choice for elephantiasis is diethyl carbamazine. So, in short, it is also called as DEC. It is also called as DEC. Now, what about ivermectin? Ivermectin is one of the drug used for condition called scabies. It can be used for scabies, also for strongyloidosis, and also it is used for one more condition called river blindness, that is called onchocerciasis. Now nowadays ivermectin is also used for COVID-19 treatment also. It is shown to have immunomodulatory property, and also it inhibits viral multiplication by inhibiting a channel called importin channel. It inhibits a channel called importin channel in COVID-19. So this is the mechanism of action. Now praziquantal and albendazole or other anti-elephantics are the option. So the answer for this question is mainly diethyl carbamazine, and it is also used for one more condition called LOA, and also it is being tried for tropical eosinophilia. It is used for tropical eosinophilia. Now let's move on to the next question. Yes, so you can see the image. You don't know the diagnosis. Patient having features shown in image, and lab investigations show high T3 and T4 and low TSH. So it's a common thing. If the T3, T4 are high and TSH is low, so what is the diagnosis? It points towards hyperthyroidism. Now hyperthyroidism, the T3, T4 are high, and you can see that there is exophthalmos in the image. Now hyperthyroidism with exophthalmos, the manifestations we point towards the Graves disease. So this is a case of Graves disease. So what is the question going to ask you? Now they are asking one of the following drug used in the treatment acts by inhibiting sodium iodide symport. So which drug inhibits that? Whether it is propylthyroxine? No, propylthyroxine inhibits the activity of thyroid peroxidase enzyme, and also it blocks the conversion of T4 to T3 by inhibiting an enzyme called deiodinase. What about Lugol's iodine? Lugol's iodine is the fastest acting anti-thyroid drug. It decreases the release of T3 and T4. That is the mechanism What about thiocyanates? Thiocyanates are present in the cabbage, the gobi Manchurian, and also in sodium hydroxide, and that is the one which inhibits the sodium iodide symport. So this is the answer, guys. It is the thiocyanate which inhibits sodium iodide symport. What about hydrocortisone? Hydrocortisone is a steroid, and steroids inhibit the conversion of T4 to T3, and that's the reason we use steroids in management of a condition called thyroid storm. We use it in thyroid storm. So the answer for this question is thiocyanate. Now, what is the image is showing it to you is Graves' disease. The investigations are pointing towards the Graves' disease. Yes. Now, one more question. Patient was diagnosed with COVID-19 and after few days presented with an opportunistic fungal infection as shown in image. Now, if you see the image, you can see the blackish eschar in the palate as well as in the nose. So this will point towards the rhinocerebral mucormycosis. So I am not going in depth with the diagnosis. My question will be restricted towards diagnosing mucormycosis. So what the media is claiming as black fungus, it's not a black fungus, but people are seeing it the blackish eschar, so that's why they are calling it as black fungus. Now, what is the drug of choice is the question now. So what is the drug of choice for this mucormycosis? This is the one question which we are expecting in this upcoming exam. The drug of choice for this is liposomal amphotericin B. The drug of choice is liposomal amphotericin B because this liposomal amphotericin B is less nephrotoxic, less infusion reaction, but the cost wise it is more. But the cheaper version is conventional amphotericin B. The other preparations are amphotericin B colloid dispersion. Then one more is amphotericin B lipid complex. So these are the preparation. Among all those things, the best one is liposomal amphotericin B. Now, what about itraconazole? Itraconazole is not effective on mucormycosis. It can be used in the aspergillosis, particularly the allergic. Along with steroid, if you want to use an antifungal, allergic bronchopulmonary aspergillosis, we can use steroid with itraconazole. Suppose there is invasive aspergillosis. Invasive aspergillosis, if they ask in the exam what is the drug of choice, this is a trending question, guys. It is oriconazole. Oriconazole. Remember, aspergillosis as A and make it V. So aspergillosis, the drug of choice is oriconazole. Now, what about postconazole and isavuconazole? These are also azole group of drug. They are also shown to be effective on mucormycosis. They can be used for mucormycosis. But why it is not a drug of choice? They are not so much effective compared to liposomal amphotericin B. They are not easily available, right? So the other drug which can be used for mucormycosis are postconazole and isavuconazole. So we have three options for the treatment of mucormycosis, and that the drug of choice is liposomal amphotericin B. Clear? That is the answer. Let me move on to the next one. So a lady was given COVID vaccine. It may be Covaxin or it may be Covishield or it may be Sputnik 5. And after giving that, she developed features shown in image. Now, what are the features? See in the image. Let me pull this here. You can see swelling of lips, swelling of eyelids. So this will point towards anaphylaxis. Now, one of the problem when a vaccine is given is anaphylaxis because many are allergic to the ingredients. So that's why any vaccine center should be prepared with one of the drug to combat this anaphylaxis. Now, what is the drug of choice for the conditions shown in the photograph? The condition that is shown is anaphylaxis, and patient may go for anaphylactic shock. The drug of choice for this is 1 in 1000 adrenaline that is given by IM route. Now, if they ask you what is the dose, it is 0.5 ml, and if they ask you which muscle, it is vastus lateralis. It is given to the thigh muscle, that is vastus lateralis. Now, 1 in 1000 we don't use it IV, 1 in 10,000 we use IV but at a lower dose, but that's not the drug of choice. The IM route is the best drug of choice, and then if you don't respond, then you can go with this option. 1 in 10,000 adrenal IM route, this is also wrong option. So the best option among all these things is this. So in your exam, you should choose the best option. Even this C looks correct, but the best option is option E. That is the best one, right? Moving on to the general pharmacology question. Following drug acts via pathway shown in image except. Now you can see in the image, this is the drug. The drug enters inside the cytoplasm, binds to the receptor in the cytoplasm, and then it will do something with DNA. There will be transcription, then translation, then the protein synthesis. Now the drug is acting on a receptor present in the cytoplasm, then go to the nucleus. So these drugs which act like this, they belong to a receptor family called nuclear receptor superfamily. Now what are the drugs which act through this receptor? You know that the glucocorticoids, the mineralocorticoids, the sex steroids such as the progesterone, estrogen, testosterone, and also vitamins such as vitamin A, vitamin D, and PPAR, and also the thyroxine. So these are the one which act through the nuclear receptor. So penultimately they are responsible for either synthesizing a protein or inhibiting a protein. So among this, yes, estrogen acts through this receptor. That's a true answer. Testosterone, yes. Hydrocortisone is a corticosteroid. It's a glucocorticoid. Now, what about insulin? So, insulin doesn't act through nuclear receptor superfamily. Insulin acts through a receptor called tyrosine kinase receptor. So, insulin acts through tyrosine kinase receptor, which is present on the cell membrane. It is not present inside the cytoplasm. So can you tell me some other drugs which act through tyrosine kinase receptor? Yes, you are right. The other drugs which can act, the other substance is insulin-like growth factor 1, insulin-like growth factor 1, and any growth factor like epidermal growth factor, vascular endothelial growth factor. Now what about interleukins, cytokines? They act through JAK-STAT pathway. Even growth hormone prolactin act through JAK-STAT pathway. So that is the answer. So the answer is D for this question. Now moving on to this question, following are given by the route shown in image except drug sensitive testing, rabies vaccine, the BCG, and the filgrastim. Now what is this route? Let me expand this and show you to you. What is this route? You have to identify this, guys. This route is intradermal route. What is that route? It is the intradermal route. Very, very important. How do I know, sir? It's an intradermal route. Now, intradermal route, when you give the injection, there will be formation of a bleb. There is a bleb formation. Only if there is a bleb formation, then I can tell it's an intradermal route. Now, if you give a drug subcutaneous, note down there will be no bleb formation. Now, why subcutaneous is very important nowadays in COVID-19? What are the drugs given by subcutaneous? One is the low molecular weight heparin, and one more is the insulin. So these are the two drugs which we are using left and right in COVID-19 in treating a hospitalized patient. So subcutaneous, the drug should be deposited in the subcutaneous tissue. Just pinch the skin, give the injection with insulin syringe, so it will only go there. Now remember, drug sensitivity testing is done intradermal. Rabies vaccine is also available intradermal as well as IM injection. BCG is also intradermal. What about filgrastim? What is filgrastim? Filgrastim is a granulocyte monocyte colony stimulating factor, and that is given by subcutaneous route, filgrastim. So the answer for this question is option D, filgrastim. That is the answer. Now moving on to the one more question. So you can see this is a spider and this is called black widow spider toxin. Now what does it do? Black widow spider toxin is known to cause excess release of acetylcholine, decreased release of acetylcholine, inhibit synthesis of acetylcholine, blocking active transport of acetylcholine into synapse. Now, the black widow spider toxin, the main mechanism is excess release of acetylcholine. That is the main mechanism of action. Now, who will decrease the release of acetylcholine is a toxin by the name botulinum toxin. You have heard of Botox. So, mainly it decreases the release in neuromuscular junction. So, The wrinkles, the glabellar lines can be managed with this Botox injection. Right? Inhibit synthesis of acetylcholine. Now that step is blocked by choline uptake inhibitor that is called hemicholine. By blocking active transport of acetylcholine into synapse, that is done by VWAT, and that is inhibited by vasamicol. So this step is blocked by a drug called vasamicol, and this step is blocked by a drug called hemicholine. That is the name. So this is the black widow spider toxin. Now, coming to this picture, a patient was advised treadmill test, but he had lost both his limbs and he was advised a stress test, as shown in image. The drug used for this test is. Now, whenever you do a treadmill test, you want to put a workload on the heart. So, we'll tell the patient to run on the treadmill and we'll monitor the ECG. So, if there are any ischemia, that will be seen in the ECG. But if the patient has lost both his limbs, he cannot do that. So, we induce this stress on the heart by giving drugs. Now, what is the drug which is used for cardiac stress testing? It is none other than it is the drug dobutamine. The dobutamine is a drug which is used for cardiac stress testing. It's a beta 1 agonist. It is mainly a beta 1 agonist which is used for cardiac stress testing. What about dopexamine and dopamine? Now, mainly remember dopamine. Dopamine can act on mainly the D1 receptor, alpha 1 receptor, as well as on the beta 1 receptor, and it is considered the drug of choice for cardiogenic shock with renal failure because it has action on D1 receptor, so it can cause vasodilation. So there it can be used for the drug of choice for cardiogenic shock with renal failure. What about dapivirine? Dapivirine is a prodrug and it's an alpha 1 agonist, so it will get metabolized into adrenaline and it is mainly used for glaucoma. So the drug which is used for cardiac stress testing is dobutamine. Dobutamine. There is other drug called regadenoson that is also used for cardiac stress testing. So for you, the main thing that will be asked is dobutamine. Yes. Now identify the syndrome which is shown in the image. Now this is a teratogenic feature. You can see there is cleft lip and cleft palate. So the image is showing you cleft lip and palate, and also you can see there is small fingers, so we call it as microdactyly. Now which condition or which drug is responsible for that? Fetal alcohol syndrome, fetal valproate syndrome, fetal hydantoin syndrome, fetal warfarin syndrome. Now the fetal hydantoin syndrome is the one which is going to cause cleft lip and palate and microdactyly. What about valproate? The valproate is mainly going to cause neural tube defect, that is the microcephaly and spina bifida. Fetal alcohol syndrome, mainly it is associated with micrognathia, that is small face, small chin, micrognathia, small chin. Along with that, mental retardation will be there. Fetal warfarin syndrome mainly affects the bone, so that is also called as chondrodysplasia punctata. So the epiphysis will be stippled epiphysis, so that will be seen in X-rays. So here, any patient present with cleft lip, palate, and microdactyly, you should diagnose fetal hydantoin syndrome. If it is neural tube defect, fetal valproate syndrome, and alcohol syndrome. The next question I will discuss that. Now identify the syndrome. Now this is what is fetal alcohol syndrome. Along with that, the babies will have intrauterine growth retardation as well as mental retardation. These are also there, and you can see that they have micrognathia, that is small chin, and also short palpebral fissure, thin upper limb. So mid facial, flat mid face, and short nose. So these are typical of fetal alcohol syndrome, which I already discussed. This is the image, guys. So it is alcohol is one of the teratogenic drug. Remember, all this teratogenic drug belongs to a category, and that is called category X. So if they ask in the exam what is category X drug, they are all teratogenic drugs. They are all teratogenic drugs. Now one more graph question. The position of beta carbolin on GABA benzodiazepine binding site in the below graph is. So what is the position of this? Now what is the graph? You can see any graph if you want to analyze, see what is there in the x-axis. You can see that there is drug is there, and in y-axis you can see the response. So it is a dose response curve, and if you see that, you can see there is only zero response at C, and you can see that there is minus 100 response in A. So what is that? So if you get a minus 1 response or minus, it is called inverse agonism. It is called inverse agonism. And if you don't get any response, the drug binds and no response, we call this as antagonism. We call it as antagonism. And if you get only in between 100 to 50, it is called partial agonism. Partial agonism. And if you get this three, it is the full agonist. Now, what is beta carbolin? Beta carbolin binds to the benzodiazepine site of GABA, and it is an inverse agonist. So, the action of beta carbolin is inverse agonism, that is opposite of GABA benzodiazepine, that is it will cause excitement. So, what is the position of that? It is at site A. So, here is the point where the drug beta carbolin belongs. Now, what about benzodiazepines? They belong as full agonist. And you know what is antagonist of this benzodiazepine receptor? It is flumazenil. It is flumazenil, guys. So that's why for toxicity with beta carbolin or barbiturate poisoning, sorry, benzodiazepine poisoning, the antidote is flumazenil. Do we have any partial agonist? Till now, we don't have any partial agonist. So that's why I didn't comment on that. So answer is A for this question, guys. Yes. Now let me move on to the next question. Following drug acts to the given receptor in the image. Now what is that receptor? You can see here the calcium is moving inside, and this is the T type of calcium channel. So this drugs, they inhibit T type of calcium channel so that calcium will not move inside the cell. What are the drugs which act by inhibiting T type of calcium channel? Yes, valproate inhibit T type of calcium channel, ethosuximide inhibit T type of calcium channel, and these two are used for the seizure disorders. Particularly, ethosuximide is used for absence seizure. Valproate is the drug of choice for generalized tonic-clonic seizure and also for myoclonic seizure, and also it is used in absence seizure if the age of the child is more than 2 years, or any atypical absence seizure, then we use valproate. Less than 2 years, the better drug is ethosuximide because of less toxicity. Flunarizine also blocks T type of calcium channel. It is used for migraine prophylaxis. Then what about lacosamide? The drug lacosamide is going to inhibit sodium channel, and also it inhibits CRMP2 channel. So what drug doesn't act through T type of calcium channel? It is lacosamide. Lacosamide. Now moving on to the next image, a patient on anti-Parkinson drug developed feature shown in the image identify the drug. Now you can see that there is something network like blood vessels, and this is nothing but it is called as libido reticularis. It is called as libido reticularis. So what drug causes this? Is it pergolide? Pergolide is a D2 agonist used in Parkinson disease. Cabergoline is a D2 agonist. Now, these ergot-derived drugs can produce mainly retroperitoneal fibrosis. They can produce retroperitoneal fibrosis. That is the main problem with cabergoline and pergolide. Now, what about amantadine? Yes, amantadine is also used in Parkinson disease. So that is the one which is going to cause libido reticularis, and also it can produce one more problem, that is ankle edema. It can produce ankle edema. Now, levodopa is a drug which is combined with carbidopa and used in the treatment of Parkinson disease. So, if you give levodopa and carbidopa, two important side effect doesn't decrease, that is psychosis, and one more important condition is dyskinesia. Those will increase. Now, the question is drug acting at site B. So, you can see A is alpha 2, B is GABA B. So, what is the drug which is a GABA B agonist? Now, is it baclofen? Is it baclofen? No. Baclofen is, yes, is a GABA B agonist. It's a GABA B agonist. What about tizanidine? It's a alpha 2 agonist. Now diazepam acts through GABA A. So GABA A is a ion channel. GABA B is a G protein coupled receptor. And the last option I think you are not seeing it is cimetidine. So what is cimetidine? Cimetidine is a H2 blocker and it is an drug used for peptic ulcer disease, but nowadays we are not using because it is an enzyme inhibitor. It can cause gynecomastia, loss of libido in males. That's why it is not used. So answer for this question is the drug acting at site B, that is GABA B, is baclofen, guys. Baclofen. So what I'm suggesting is when you are seeing this video, pause this video, see the question, and then you try to answer. Then you see the video solution. That will be the best one you can do it. Drug not used in the procedure shown in the image is. So what is this procedure? Now this is a cuff that is being tied in the arm, and if you want to do any orthopedic surgery on this arm, we will tie this and inject the drug. So this procedure is called intravenous regional anesthesia. So it is a local anesthesia where the anesthetic will only work in this point. So to prevent the drug from absorption, we tie a tourniquet so the drug works locally. Now the problem is even if you are tied so much, the drug can enter into the body. And in that the most dangerous one is bupivacaine. Even if you give bupivacaine with that dose, it can cause cardiotoxicity. It is cardiotoxic if it gets into the systemic circulation. So in this procedure, better avoid bupivacaine. So bupivacaine is contraindicated in intravenous regional anesthesia. The reason is if some amount of drug enters inside the system, it can cause cardiotoxicity, but that is not seen with these drugs. That is lignocaine, prilocaine, and benzocaine. So there it is not seen. Now moving on to the next problem, the drug known to cause below changes in the eye. What is the change in the eye? You can see the eyelashes are normal, pupil normal. Then what you see here is the whitish discoloration. It is nothing but the cataract. So which drug can cause this cataract? Is it prednisolone, montelukast, salbutamol, or paracetamol? Now this cataract is caused by the prednisolone which is used systemically. Either it is used oral. So when you use oral prednisolone for a very long time, the patient may come back with this problem, that is cataract. So we are using extensively steroid in COVID-19. That's why in this video I am going to tell you what are the adverse reactions with steroids. Now if you are using steroid for a very long time, they can cause Cushing syndrome, osteoporosis, reduced growth in children. So in that the safer one is deflazacort because it will cause less growth retardation, thin skin will be there, immunosuppression. That is the reason we are getting all the opportunistic infections. So we are getting opportunistic infections such as what you are seeing in the media, black fungus, yellow fungus, and white fungus because of this. Even I have seen the tinea infections getting flared up because of steroid usage. Cataract, what I am discussing now, when you use systemically, but when you use it as eye drop, the complication what we get is glaucoma. So it will can cause edema, that is sodium and water retention. If you suddenly stop steroid, they can cause suppression of HP axis. So remember this for your exam, guys. When a steroid is started, when you want to stop the steroid, if you are using for more than 2 to 3 weeks, better to taper the dose and gradually withdraw. If you don't do that, suddenly stop it, patient may go for coma. It is teratogenic if you are using in pregnant. It may produce emotional disturbances. It will raise BP and it can cause obesity. It can increase IOP and also it can increase glucose. So that's why we are combating diabetes. So many patients we are putting on steroids. So what is the problem we are facing? The sugars are getting shot up. So diabetic risk is increasing. So remember this one chart. I want all of you to remember what are the adverse reaction with steroid because we are using them extensively. Now moving on to the next question. Patient was given an antipsychotic drug and later developed a feature shown in the image. Drug used to treat this feature is. Now what is that? Now if you see that the tone of the neck muscle has changed. So we call this feature as acute dystonia. Now acute dystonia is one of the extrapyramidal symptom that is seen when we use a D2 blocker. Now, what are the options? Levodopa. Now, levodopa is a prodrug which becomes dopamine and it will act on the D2 receptor. Amantadine is a NMD antagonist, an anticholinergic drug which has anti-dyskinetic property. It doesn't cause dystonia. I told you already it causes libido reticularis. Benztropine is an anticholinergic drug used in drug-induced Parkinson disease. Now, what about selagelin? What about selagelin? Selagelin is a MAO-B inhibitor. MAO-B inhibitor. Now, what is the question asking? What is the drug used to treat this feature? Now, what happens when we use D2 blockers? Now, you know that typical antipsychotics are D2 blockers. Typical antipsychotics are D2 blockers, and in the question we have mentioned that antipsychotic was given, D2 was blocked. Now, to reverse this dystonia, what happens in the body? There will be increased acetylcholine. I have to decrease this acetylcholine. So, the drug which decreases acetylcholine is called central anticholinergic. That is the drug which I can use in the treatment of this acute dystonia. So, what is that? The central anticholinergic is benztropine. You can use benztropine, piperidine, or benzexol. If that is also not available, you can use an antihistamine called promethazine, so which is available easily in the casualty, so that can be used for acute dystonia, which is because of D2 blockade by typical antipsychotics or by an antiemetic called metoclopramide. There you can use it. Let's now moving on to the next question. Drug for the patient with renal impairment in chronic treatment of the condition shown in the image. Now, please remember it's a image of foot, and you can see that redness and swelling of first metatarsophalangeal joint. Now, in the future, if you see this swelling of first metatarsophalangeal joint, the diagnosis goes towards acute gout. So here they have asked for chronic treatment if you want to use, which is safe in renal impairment. Now, naproxen is an NSAID, and NSAIDs are not used in renal impairment because they themselves can cause renal impairment and chronic usage. Sulfenpyrazone and propanacid are uricosuric drug, and they are not used in renal impairment because they will work only if the kidney is functioning normal. Now, what is the best drug? The best drug is allopurinol, which is a xanthine oxidase inhibitor. If that is not there in the option, we have another drug for that, and that is called febuxostat. That can also be used in the condition. The ADS seen in the adjacent image is due to, so this is what you mean by the Smurf skin. So it is the Smurf skin, or we call it as blue man syndrome. This is caused by the drug amiodarone. Now the examiner is asking repeatedly the adverse effect of amiodarone. Remember, when you think of amiodarone, think of three things. Pulmonary function test, it will cause lung fibrosis. Liver function test, so it will affect the liver, it will damage the liver. Then thyroid function test, it will cause both hypo and hyperthyroidism. So any patient presenting with this and he is being given an antiarrhythmic, what is the drug? If they ask in the exam, it is amiodarone. Now, what about ivabradine? Ivabradine, you remember IV, so it causes impairment of vision, and it is used in angina as well as CHF. Bretylium is the class 3 antiarrhythmic. Quinidine is class 1A antiarrhythmic. Mainly quinidine causes hypoglycemia. Main problem with this is hypoglycemia, as well as it can cause diarrhea. It can cause diarrhea. That is the problem. Now, moving on to the action potential shown in red line indicates the following antiarrhythmic drug according to Vaughan-Williams classification. You know that we have 4 classes in antiarrhythmic: 1, 2, 3, and 4. Class 1 is sodium beta blocker, potassium channel blocker, and class 4 is the calcium channel blocker, and 5 is miscellaneous. Now they have asked in 1, is it 1A, 1B, or 1C? Now the black one represents the normal graph, the red one represents the 1A, 1B, 1C. Now, how do I identify that? Now, remember, if the action potential duration has increased, so this is the action potential duration in the graph, and if it is increased, it is class 1A. Now, what about class 1C? Class 1C, the slope dV by dt will be decreased further, and there is action potential duration will be same. But what is the change? The dV by dt will be here. The dV by dt will be here. But what about the class? This one is 1C. What about class 1B? It will only cause mild decrease in dV by dt, mild decrease in dV by dt, and it will reduce the action potential duration. So this one is class 1B, right? So if the action potential duration is normal, 1C, if it is long, it is 1A, if it is short and 1B. And also slope, it is closer, that is 1C, then we have 1A, and the steepest is 1C. So this is the classification of antiarrhythmic class 1A, 1B and 1C. Now, 58-year-old patient with heart disease presents with breathlessness. The patient features are shown in the image. Which drug is best to reduce the edema in this patient? Now, what is this case? You can see coughing, pleural effusion, swelling in abdomen, tiredness, shortness of breath, pulmonary edema, pumping action of the heart got weaker, and you can see swelling in the legs. So this will points towards acute heart failure, and in acute heart failure, the diuretic of choice will be loop diuretics. So they have asked which is the best drug to reduce edema in this patient. Carbonic anhydrase inhibitors, no. So the loop diuretics are sodium potassium 2 chloride co-transport inhibitors. So this is the right answer. These are the drugs, loop diuretics, which we use in the management of pulmonary edema in acute heart failure. Now what about sodium chloride co-transport inhibitor? They are thiazides. They are not used in pulmonary edema. Aldosterone antagonist is spironolactone. So spironolactone is mainly used in chronic heart failure, not in acute condition. Right. So the answer is B. Now feature shown in the image is caused by, so this feature is called purple toe syndrome, and the purple toe syndrome is caused by the drug warfarin. The drug is called warfarin that causes purple toe syndrome. Heparin, Lipirudin, dabigatran, they don't cause this. Remember, anticoagulants are also trending nowadays. Now we are using novel oral anticoagulants. What are those? One is the direct thrombin inhibitor and one is 10A inhibitor. The only oral drug which is direct thrombin inhibitor is called dabigatran. So this question is expected, dabigatran. And 10A inhibitors you can remember by the name rivaroxaban, apixaban. Now what is the advantage of them? You can remember them easily. XA band, 10A band, XA band, 10A band, and you have to remember dabigatran. Now compared to warfarin, what is the advantage? Why are we prescribing left and right nowadays? Because they require no lab monitoring. So there is no need of lab monitoring, but if you are using warfarin, you have to do INR. Even low molecular weight heparin, there is no issue. There is, because it also doesn't have any lab monitoring. So that's why we are using low molecular weight heparin. How do you identify them? They end with parin. For example, enoxaparin. Right. So these are the drugs. Now this is the syndrome. The below image represents the following. So just now I told you, you can see there is the bone abnormality, and whenever you see a bone abnormality in the image, you have to think of warfarin. Warfarin affects the bone, so it is a fetal warfarin syndrome. Alcohol syndrome and identin, I have told you. Gray baby syndrome is caused by a drug called, starts with C, it is called chloramphenicol. It is by chloramphenicol. Okay guys. Now moving on to the next one. Iron injections are given by IM route by the following technique. Why do we give iron injection by this technique? What is the technique? You can see here. The technique you are seeing is Z-track technique. So this is called Z-track technique. Now what happens if I give an injection like this? The drug may come back and it may go out. So if it is iron injection, what happens? The iron injection, it is colored and it can cause staining of the skin. So that is not desirable by the patient. So if I do Z-track technique, what happens? The drug will not enter back, it will stay inside. So why do we do this technique while giving iron injection? Remember guys, it is to prevent staining of the skin, not to increase the efficacy, not to reduce allergic manifestation, not to decrease adverse effect. Can you tell me one more group of drugs which are given by this technique? They are called antipsychotics. Even antipsychotics are given by Z-track technique. Okay, remember this is the Z-track technique. Now this is the drug obtained from the organism shown in the image inhibits the following factors. So this is the leech, and what we obtain from leech is Lipirudin. So I told you Lipirudin is a direct thrombin inhibitor. So anything ending with rudin will be direct thrombin inhibitor. And one more you have to remember is argatropan, that is also ending with, that doesn't end with that. So it's a tropan, it is also direct from an inhibitor. So they inhibit factor 2A. So they have asked which one they inhibit, it is the factor 2. That is the one which they inhibit. Now the side effect shown in the adjacent image is due to the following. So you can see the large intestine, they have mentioned it here, and you can see the black pigmentation throughout the intestine. So this is called melanosis coli. So melanosis coli. So coli stands for colon, melanosis, the melanin, that is the pigmentation of the intestine looks like the black pigmentation, we call it as melanosis, and that is caused by a laxative called senna, and one more is cascara sagrada. They can cause melanosis coli. So sodium picosulfate, lactulose, liquid paraffin, they don't cause this problem. Now moving on to the next question, histopathological change shown in image is caused by, what is the histopathological change? I am not telling you anything here, so I am just giving the option foreign body granuloma. Which drug causes that? Lactulose is an osmotic laxative, it will not cause. Liquid paraffin is a mineral oil, so what happens, the macrophages will ingest that, and that will be responsible for foreign body granuloma. So this is the right answer. Now docosides and bisacodyl, they are also the laxatives which is used during constipation. Now identify the regimen of the pill. You can see that this is a triphasic regimen. How do I identify that? If you find 4 different colors of tablets, so you can see one, second color, third color, and fourth color. So if there are 4 different colors, then it is triphasic. 4 different colors. If it is 3 different colors, it is biphasic pill. If it is 2 different colors, then it is monophasic pill. This is the clue for your exams. Now, the reason why we give phasic pills is to prevent that with trouble bleeding and also to stop the spotting. So this is the reason. Remember, 4 different color, it is a triphasic pill used as oral contraceptive. Now, this is an image, and what do you see by this image? This is one of the image where I want to tell you this is the insulin pump. So it is kept in the abdomen, and depending on the glucose level, the patient can adjust the dose and inject. So what are the insulin preparation we use for this? We can use aspart, we can use glulysin, we can use regular insulin. We don't use glargine. So the question is, all the following can be used. So what are the drugs which can be used in this insulin pump? It is the rapid acting insulin as well as the short acting insulin, that is regular insulin. So other insulins are not used in the device, that is insulin pump device. So the following adverse effect shown in the image is caused by which one? So this is the osteonecrosis of bone, particular jaw bone, and that is caused by a bisphosphonate that is called alendronate. So teriparatide is the only anabolic agent used for bone formation. Salmon calcitonin is highly potent drug used for hypercalcemia. Denosumab is against rank ligand which is used in osteoporosis. Drug known to cause the disorder shown in the images. So you can see here, this is the liver, this is the bile, biliary tract. You can see the gallbladder, there is stone. So which drug can cause this stone? It is none other than octreotide. So octreotide is the drug which can cause stone. Can you tell me one more drug, antibiotic which can cause stone? Is ceftriaxone. So ceftriaxone can cause pseudolithiasis. Now we are also using ceftriaxone for COVID-19 to prevent secondary bacterial infections. So this is a question which may be expected. Drug which acts similar to osteoprogetin is, now what happens? The osteoblasts are synthesizing rank ligand, and rank ligand is attaching to the osteoblast precursor, and now it is becoming osteoblast is becoming osteoclast. Now we have an endogenous something called osteoprotein that is blocking this rank ligand. Which is the drug which acts similar to that is a question. It is none other than denosumab. So denosumab blocks this rank ligand and it will not allow the osteoblast to become osteoclast. So it will not allow the osteoclast activation. Teriparatide is an anabolic agent. Strontium ranitide specialty is it can increase bone formation and decrease bone resorption. Relaxifene is a serum which is approved for postmenopausal osteoporosis. Now identify the drug cleaved by beta lactamase. Identify the ring. So we have A and B ring. So this is the beta lactam ring and this is the thiazolidine ring. So beta lactamase are enzymes produced by the bacteria. So they mainly cut the beta lactam ring. So the answer will be A. So there is some confusion. So just remember for your exam, this is the beta lactam which is being cut. Drug shown in images. Drug A shown in images. You can see here drug A is inhibiting transglycosylase, drug B is inhibiting transpeptase. So transglycosylase is inhibited by the drug glycopeptides such as vancomycin. Transpeptidase is inhibited by beta lactams. Now, what is the drug? Clindamycin is a protein synthesis inhibitor. Clarithromycin is a macrolide, which also protein synthesis inhibitor. Vancomycin is the one which inhibits transglycosylase, and amoxicillin is a beta lactam which inhibits transpeptidase, which is required for cell wall synthesis. So the answer is vancomycin, which inhibits transglycosylases. Now remember drugs acting at site Y. X is, you can see PABA is becoming dihydrofolic acid, tetrahydrofluoric acid, and in DNA. So drug X and Y you have to identify. X, you remember X is inhibited by the drugs such as sulfonamides, right? Sulfonamides inhibit that, proguanil will inhibit that, PAS will inhibit that. Now they are asking why. You can remember as PMT. P stands for pyrimethamine, M for methotrexate, T for trimethoprim. So this drug which inhibits this path is trimethoprim. Now what about dapsone? Dapsone inhibits this step. Pyrimethamine inhibits this. So they have asked this question, read carefully. Drugs acting at site Y are all. So trimethoprim will act, pyrimethamine will act, methotrexate will act. So which is the only drug which will not work? It is dapsone. But dapsone works in dihydropteroid synthetase step. So this is how the flowchart can also be asked in the exams. Now this is one of the devices which everybody was prescribed during the pandemic. That is, this is called meter dose inhaler. Now what is the most common drawback of this? Portability is not a drawback. You can carry this anywhere. Portability means you can carry it anywhere. Does not provide instant relief. No, it is an instant relief provider. Many people during acute attack they take this and immediately the vasodilation, not the vasodilation, bronchodilation. Drug deposit in the oropharynx. That is the main issue, guys. So I told you when this is being taken, the drug gets deposited and it may lead to side effects such as oral candidiasis. So that is a drawback. Must be administered in hospital settings. No, that is not a drawback. You can take it in the home also. So this is one of the important device called meter dose inhaler. Now you want to prevent this drug deposit in the oropharynx. What we can do is we can use something called spacer. So spacer will avoid the drug deposition in the oropharynx. Now if you want to prevent a complication, what you have to do? You have to do gargling after each dose. A 15-year-old female complains of cough, sore throat. She was prescribed an antibiotic, following which she came back with this symptom. So if you see this hand, you can see the rashes, and it is nothing but allergy. So which drug can cause allergy? Fexofenadine is an antihistamine. It will not cause allergy. Salbutamol is a beta agonist. Amoxicillin belongs to beta lactams. You know that beta lactams are responsible for causing allergy. So that is the right answer. Corticosteroid, they themselves will not cause this allergy because we use them for treatment of allergy. So the answer is amoxicillin. Now you can see in this image there is flagellate dermatitis, and many times they may not give you this. They will ask you the lesion shown in the image is caused by. So you can see this flagellate stripe like lesions. This is caused by a drug called bleomycin. So bleomycin will cause flagellate dermatitis, and also bleomycin causes pulmonary fibrosis. Adriamycin belongs to the cardiac. They belongs to the Don Robertson sorry. So it belongs to the anti-cancer drug antibiotics. And the main problem with these are Don Robertson, doxorubicin is they can cause cardiotoxicity. That's the main issue. They can cause cardiotoxicity. How do you prevent that? It can be prevented by using a molecule called dexrazoxane. So that is the one. Okay. So clarithromycin and amoxicillin are antibiotics or antimicrobials used for bacterial infections. Now, what is a drug causing syndrome shown in image? So, drugs causing syndrome shown in image are all except. Now, you can see the hand and you can see the foot. So, this is a typical of hand-foot syndrome, and that is caused by capacitinib, 5-fluorouracil, and also by imatinib. So, sunitinib is not going to cause this. Now, I don't want you to remember all those things. Remember, hand-foot syndrome is mainly caused by 5-fluorouracil. That is the one which you have to remember, guys. So one of the drug taken in pregnancy may lead to the condition in the image, but later the drug was not used in pregnancy but used in below conditions except. Now here you have to identify the condition, then you have to identify the drug. Now if you see this fetus, the baby which has been born, you can see that it has short upper and lower limbs. So this is called seal limb deformity. Now this seal limb deformity is also called as pocomelia. Now, the drug which can cause this is called thalidomide. Thalidomide is not used in pregnancy, but now they have found out so many uses of that. It is used in erythema nodum leprosum, multiple myeloma, sarcoma. It is not used in gastric ulcer, but it is used in mouth ulcer called aphthous ulcer. So the answer is D, gastric ulcer. It is not used. Okay, guys, that's it for the image-based discussion. And most of the times, I have tried to cover the trending questions which may come in the future FMGE June 2021. So, any doubts you can post in the group in the video comment section. I will be happy to answer all your queries. And I've tried to cover most important images which are going to come. And thank you all. Take care. Stay safe. All the best for your upcoming exams. So, thank you.